Hello guys, I'm a physical therapist Sue in AFA and I am with our patients. And hello, how are you?
Hi Sue, how are you?
I'm good, thank you. What about you? Are you good?
I'm great.
Okay. Firstly, how did you decide to do limb lengthening surgery?
Yes, I have been thinking about this for actually over 10 years. And before it was the LON method. And then recently I saw videos on the Precice over the last couple of years. And I was like, you know, that looks like it could be a better option. And then I started to look more into the whole lengthening procedure here in Turkey. So yeah.
And then you found us.
Yes.
Okay.
Yeah.
Which method did you do?
Yeah, I did Precice femur and I got 7.4 centimeters and I just finished lengthening a month ago.
What do you think are advantages or disadvantages of your method?
The advantages are much greater than the disadvantages, especially for Precice. So for the LON, you have the infection risk, you have the bigger scars, you have the pin pain, you also are unable to shower, swim, you're pretty much tied, you can't really sit in smaller chairs or in cars, it's very uncomfortable. Precice gives you a lot of flexibility. You can definitely do all the other things that I just said you can't, and you don't have a much greater risk of infection. The flexibility is great. You could sleep much more comfortably. So it's really a much better procedure.
Also, one of important exercises is like hydrotherapy, you know, so you're able to do hydrotherapy, and I know personally you're doing hydrotherapy a lot.
Yes, absolutely. It's my first and my go-to PT and physical therapy, and it saved my life because I was able to recover quickly and feel really good.
So you had an intense physiotherapy period here.
Mm-hmm.
Can you briefly tell us about the physiotherapy process and sessions like?
Honestly, one of the most and one of the best things here at AFA are the PT sessions. One of the reasons I chose AFA is they have a professional team, and you also have longer PT sessions, 2 hours, than any other facility that does the surgery, which is not even enough in my opinion, because you really need the stretching throughout the whole process. And if you're doing Precice and you do hydrotherapy, PT becomes so much easier, but it's so important.
What advice do you have for patients candidates? Would you recommend this surgery?
I do, if you feel like you need it. The surgery, you have to be prepared though. Mentally you have to be prepared, financially you have to be prepared. Health-wise you have to be prepared. If you have any bad habits like smoking, a lot of caffeine or alcohol, I would recommend that should stop, you know, a while, maybe 6 months to a year. A lot of stretching prior to surgery will make a huge difference. The surgery is safe, it's doable. I've seen people come and go, but I've seen difference in, you know, how you approach the surgery mentally and financially and all these aspects that I just talked about. But it's definitely doable, it's safe. You can do it if you feel like you need it. Precice is a safer method in my opinion, and it's much easier journey. Overall, yeah, we did it.
Yeah, you did it, and successfully.
Successfully we did it, yes.
By the way, are you thinking another surgery? This is my personal question.
Yeah.
Are you gonna do second surgery, tibia surgery?
So, this is a very, very big decision. As you could see, recovery takes a while. So the surgery lengthening takes 3 months, and then maybe another 3-4 months. So you have to be free for 7-8 months.
And also maybe you have to prepare yourself again financially,
yes.
mentally,
yeah.
everything.
So there's a lot to the surgery. It's long term. Even after you start walking again, you don't walk normally, you don't walk right away, you don't run right away.
Yeah.
So I would say you need a year to be safe. So this is not the easiest decision to make. I would love to be even taller than I am right now.
Yeah.
However, it will take a lot to make that decision. Maybe after recovery, and depending on the flexibility of my new job and all that. But that would be like a down the road kind of decision. Maybe when I come back for removal in a couple of years, I will see where I am mentally, physically, financially, and then, but the tibia also, specifically, is a much more complicated surgery than the femur.
Yeah.
You're breaking more bones, more scars. Your Achilles tendon needs to be very, very flexible because you can get the drop foot, and that can last a long
You
time.
know everything.
If
Like
you
a
sit here, you
pro.
become.
Yeah.
If you do this, you become an expert. But I feel like the tibia is also, you don't get as much height as the femur, so it would be a tough decision to make.
We will see.
We will see. Only time will tell.
Okay.
But you never know. You really never know.
Thank you for doing this interview with me.
Of course.
That's my whole question. Thank you for answering. And all the time, as you know, guys, I have to hug my patients again. We can finish. Thank you. You don't
Thank
have
you.
to
Thank you so
stand.
much.
Of course,
Yeah,
you're
of course.
welcome.
Thank you,
See you
guys.
guys. Thank you for listening.
Good luck.